Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. We're talking about palliative care, which is specialized medical care for people with serious illness. What is the difference between palliative care and hospice?
Palliative care is a medical specialty, and the focus of palliative care is to help patients who are living with a serious life-limiting illness at any stage of that disease, to support their families, with a goal to enhance their quality of life by addressing pain and other symptoms, by addressing any form of suffering, whether it's emotional suffering, relational challenges, fear of the unknown, difficulty with medical decision making. And it can be at any stage of illness with someone who's dealing with a serious life-limiting illness. Hospice, on the other hand, is a focus of palliative care for people who are now nearing the end of life within the last 6 months. And most of those people are choosing to be at home and choosing to focus their care entirely on comfort, not just on cure and comfort at the same time.
Who is palliative care appropriate for?
Palliative care would be good for any patient, as I mentioned, who's living with life-limiting illness. It can be somebody with advanced cancer. It can be someone with HIV. It can also be with someone who's dealing with heart failure and their symptoms are starting to progress, or someone with dementia and the families are having difficulty knowing how to make decisions and how to proceed and get the resources they need, or decide what kind of placement or whether or not to obtain a feeding tube. It also can be for people who have breathing difficulties like COPD or other lung diseases. So any illness, really, that someone now is defined as having, is now starting to have symptoms that are burdensome.
What's an example of a patient who would benefit from palliative care?
In addition to the patients that we often see who have cancer, there are patients, for example, who might have had multiple hospitalizations recently. Or, for example, one woman who I met who had advancing dementia and who fell in a nursing home and broke her hip. And the family now is facing what do we do with somebody who, with our mother, who now not only has dementia and can't really speak for herself, but also is struggling with pain, with a broken hip. Do we fix it? Do we not? What are the options going forwards? This is a wonderful situation where we can help families make decisions, figure out priorities, help with symptom management for pain, whether someone chooses to pursue surgery or chooses to pursue a non-surgical approach. And we can help the families negotiate all of that. So that's an example of someone who we can help with. And the people who are involved in terms of a team, in addition to physicians who come from a variety of specialties and then do additional training in palliative care, are nurse practitioners, nurses. Some of the floor nurses at UMass, for example, are certified in palliative care and provide support and guidance to families even when the specialty team isn't around. We have social workers who are specialized in palliative care, both on the inpatient side, but also they're community-based social workers who can provide the expertise. And we also have pharmacists here at UMass who has expertise to help teach the families and patients about what medications perhaps they don't need anymore, or which would be most helpful for managing their symptoms. So it's truly an interdisciplinary team. And the other member of the team that I can't forget is the chaplain. We reach out often to community chaplains, but our hospital chaplains and chaplains within hospices and nursing homes also play an important role in providing the spiritual support for patients and their families.
How does palliative care work with a team approach?
In the palliative care team at UMass, we have board-certified and fellowship-trained physicians, as well as nurse practitioners who are certified in palliative care, social worker, nurses on the floor who are also certified, and we work very closely with our hospital chaplains.
How does someone arrange for palliative care?
Well, you can access palliative care in a number of different ways. For someone who's in the hospital, what I would recommend is as soon as you have any questions, if a family member of yours has been to the hospital more than a couple times within a few months, you can ask the doctor who's in charge, to get palliative care involved. So advocating for your family member at that point in time is one way. On the outpatient side, we have an outpatient clinic. And so asking your primary care doctor or your oncologist or your cardiologist for referral to palliative care. There's even a palliative care doctor in the kidney clinic. And additionally to that, and within the community, there are some palliative care nurse practitioners who can make home visits that are affiliated with some of the hospices in the area. The other piece is visiting nursing services have palliative care teams available too, who don't have the physicians necessarily to do the home visits, but they have the nurses, the social workers, and the other providers who can help with making decisions for transitions towards hospice.